Good afternoon. My name is Peggy Wilson, and I'm the starter of Empowered Pelvic Health with Peggy, which you can find me on Instagram, Facebook, and YouTube. Today, we are going to talk about pelvic health, obviously, as well as pelvic floor coordination. Pelvic floor coordination is basically the movement of your pelvic floor, and not just a little bit of movement, which is probably what most of us know, but it is the full movement of the pelvic floor. We're going to go over a little bit of anatomy today and also kind of give you a little bit of insight of all the things that we can kind of treat and go over that you can then apply to yourself and basically kind of figure out, like, what do you want your pelvic floor journey to look like? Is it because you have some incontinence, whether it's when you cough, laugh, or sneeze, or maybe it's some incontinence as you have the urge to go to the restroom and you're trying to make it to the restroom and you have a little bit of dribbling coming out. Those are all things that happen to many, many women. And we're going to talk about women today, and then later on this week, talk about men. I thought I would kind of give them separately because putting them together can sometimes make the videos really long. And I would really like these videos to be a little bit shorter because I know we're all very, very busy. So my goal today is to broaden your mind and your understanding of your pelvic floor and all the things that it can do. I did talk about a little bit of the symptoms that you might be experiencing, and we'll kind of bring in some other symptoms as we talk about the pelvic floor and all the things that, and well, not all the things, but just the understanding that you have of how it moves with your body and what it's supposed to be doing for you. So, just really quick, a little bit more about myself. I have 7 children. I have birthed 7 children, and each one, I feel like the labor was a little bit different. And so just a variety of experiences with each birth, from some being totally medical. I've not had a C-section, but I do treat them. And almost came really close with one, and then all the way to doing natural at home with a midwife. I've always had really good providers with OBs through midwives, and have just appreciated everyone's time and energy and expertise in helping me just kind of basically bring my children into the world in a safe environment. The other side is I've never had anybody talk to me about pelvic health after having a baby. I think I might have said something to, let's see, I think after my fourth, I might have said something to somebody, to one of my providers, and they were like, oh, just do your Kegels, you'll be fine. And I was like, oh, okay. And I kind of knew about Kegels. I kind of knew that it was squeezing down there. And I just kind of did the best that I could. But ultimately, I still experienced some leakage, especially if I played soccer or kickball or something like that, right? I experienced leakage after my first child, and I will never forget this experience of jumping on the trampoline. She was young, I think like 6 months old, and I was so excited to get her on the trampoline, and because she could sit up. So I put her on the trampoline way over, it was a big one, way over there, and I went over to the other side, and I thought, I'm just gonna do a toe touch. I just feel like I could do one, and I do one, and I bring my legs up, and I'm like, I land, and I felt a little like something, and I was like, oh my gosh, I've never had that happen to me before. I remember going in and later calling my mom, and my mom was like, well, that's just kind of how it is. Like, that's just kind of what happens after you have a baby. And I really was kind of like, really? Really? Is this like, this is it? This is what I have to deal with for the rest of my life? And I had my first one when I was young. So being 20 years old and knowing that I was gonna maybe possibly pee my pants at one time or another, and not full bladder, but just a little bit, it really bugged me. So fast forward many years, I went to PTA school. They had a couple of hours where they kind of talked about women's health a little bit and pelvic floor health, and said, hey, there's a whole specialty for this. And I just could not believe it. I could not believe that there was help that addressed these kinds of issues that I had not heard of, or nobody had even talked to me about it. So right when I graduated, I contacted the APTA. They were giving pelvic floor classes, got permission to go, went and did that. And it was very eye-opening, very helpful. And I just knew that that's what I wanted to do. That was something that I wanted to shout from the rooftops and help women know that that was not normal. And it's not saying anything to our moms, because that's what they were told, right? I mean, we have a whole like multiple shelves and like maybe 10 feet at every grocery store full of pads and panties for incontinence. I mean, it's a huge market for it. And they're telling us, hey, this is what your life is like. This is it. This is it. You come and buy this stuff for the rest of your life. And it is not true. Not true. Okay? Because you can learn about your body. You can know what's happening down there in your pelvic floor as you move. So, getting started on that note, pelvic floor is kind of like a hammock. Okay? This is your pubic bone, and it comes all the way down and attaches to your tailbone, all right? And then it comes up to the sides. So you can see here, it kind of comes up through the sides here. But what it's gonna do is it's gonna support all of the organs above it, not just these three, right? But we have our intestines, you have your stomach, your liver, everything above that. This is keeping everything from falling out between your legs. So it's very important, but it lifts, right, to support, which is what people call a Kegel. It's a contraction of the pelvic floor. But the thing is, what people don't think about is that it goes to a neutral. Your pelvic floor is like a suspended muscle being in a neutral state. So it's just kind of hanging out here. And as we move and jump and run, it goes like this, okay? So it's going up and down like a trampoline, basically absorbing the impact and making it so that it's just not like our organs coming and hitting against a hard muscle, okay? It's going up and down and absorbing that impact. So yes, it goes down. So as we Kegel and strengthen coming up and going neutral, contracting, neutral, it goes the opposite direction as well, and neutral. Lengthen, relaxation, and neutral. So it's kind of like your bicep. If you're just contracting your bicep all the time and you're not ever stretching it and you're not ever bringing it all the way down, let's say you're just kind of going to where it's slightly bent and then bringing it back up, right? You're going to end up with kind of a bent arm because we're not lengthening the arm out. We're not stretching that tissue out so that we can get the full length of movement. So when you see guys at the gym that have kind of the bent arms like this and they're kind of walking around like this, yeah, they just have really tight biceps and they just do a lot of contracting, but not like relaxing and taking it in another direction. Okay. So that's what I kind of like to describe to people that come into my office, is a lot of education saying, hey, it goes both directions and we need it to go both directions. So some symptoms that you might have if your pelvic floor is tight, meaning it's coming up and it's kind of stuck up here, is pain with penetration, hip pain, back pain, and it can start from the hip and come towards the pelvic floor, or the back and come down into the pelvic floor, or it can go out that way. So it can start in the pelvic floor and then come out towards those areas. Also, lower abdominal pain. People I have come into my office have lower abdominal pain because right above where the pelvic floor attaches behind your pelvis bone is where your deep core muscle, your transverse abdominis, which is a mouthful, so I say TVA, can come really up and affect that transverse abdominis. And so times where you might have, if you have intense cycles where you're kind of bent down, you're doing this every time, but once a month, right? 2 or 3 days, once a month, you're kind of bent over. And you might find that, man, every time I try and stretch up, I just have a lot of tightness that comes through here in my lower abdomen. So that can radiate down and in, and vice versa. So if you've had, when you go to the hip, labral tears, Any kind of groin issues can cause pelvic floor pain. So what happens is that as you are stuck up here, right, you're not getting down to neutral. You're just kind of stuck up here. And then if I see you come into my office and you're saying, hey, I have pelvic pain and I have incontinence. And I'm like, okay, let's just do your Kegels. What are we doing? We're just Kegling, like in a stuck position, and you're moving maybe that much when really we could be moving this much, you know? And so we're trying to unstuck that pelvic floor. So Kegels always aren't the answer. Sometimes it's just getting coordination of the pelvic floor to go up and down, to unstick that and get that mobility first. And then we're gonna work on strengthening. You will be doing Kegels, right, to get that mobility, but we're not going to keep it in a strengthening phase where we're just gonna go from neutral and up to contracting, okay? So a little bit about your pelvic floor. You have 3 muscles. Strike that. You have 3 levels. I don't know why I said 3 muscles. You have a lot of muscles down there. But 3 levels, okay? Level 1 and 2. Level 1 is here. All right. Level 2 to the pubic symphysis down to the tailbone. All right, to the tailbone. And if you look, she is such a great artist. That's why I purchase her stuff, because it is so, I feel like it's so much more easy to explain this than show you a picture of like just red muscles, right? If you look at the striation of these muscles, especially these here too as well, that go circular, they come in, all right? They come in, and the circular ones, they tighten together and they might lift a little bit, but it's transversely, meaning across the body, all right? Here is your urethra, where it is nice and shut tight. Your anus is like that as well, but because we do internal exams for some of my people, they have the holes there so that we can show them what we're gonna do, as well as sometimes I will try and educate them to work on an internal exam on themselves. And so these muscles, they come in. So when you do a Kegel, you might feel a squeezing of the vaginal muscles, of them coming in. And that's exactly right. That's what we want them to do. But you will know now that is level 1 and 2, okay? Now, here's the kicker. Not the kicker, the big surprise that I always used to like to bring out. This is level 3. Level 3 of your pelvic floor is the powerhouse of the pelvic floor. Those 2 levels, they have their purpose. This level is what absorbs all of the shock. This is a hip rotator. That's a hip rotator, okay? Obturator internus, piriformis. You've probably heard of the piriformis plenty of times. Maybe, maybe not. Hip rotators, all right? This can be tight. They're usually tight together, but this can be sometimes really tight. This is not tight. This can be tight. This can be not tight. That can be tight. So you can see all of them work individually, as well as these ones that I showed you earlier, right? Those work individually as well. So when we do an assessment, we kind of go through and check and say, okay, which ones are tight, which ones are not tight. But this is also something that you can learn to do to yourself. You don't necessarily have to go see a provider for this. And this is, again, why I'm doing this, because a lot of this is such educational purposes that these are going to take up for your first 4 to 5 visits going to a physical therapist that specializes in pelvic health, for them to just kind of teach you about your own body. Because our pelvic floor is in our body, it's really hard to see and to know. We have to really like build the brain to body connection and be more aware of what your pelvic floor is doing. So same thing, urethra, vaginal, anus, okay? These are all attached to your coccyx. So we can have it pulling in different directions. We have tightness over here. We can have laxity over here. Your pelvic floor can be tilted side to side or front to back, just because there's so many muscles. That's really all it is. It's just because there's a lot of muscles that come in. Each one's almost like a puzzle piece of where we're trying to figure out, okay, where are we having issues? This is not to overwhelm you, because a lot of times our bodies are just so amazing that they want to work together. They want that connection with the brain, and they want to work in coordination. So this, though, does something different. These, as you can see, they have striations all over. So these ones striate this way. They're coming in and together, but all of these, they come up. So they're lifting up. So when you do a Kegel, if you feel a squeeze and a lift, okay, squeeze and a lift, that is a full Kegel using all 3 levels of your muscle and getting all of them to participate. All right. So this week, see if you can feel a squeeze and a lift. Think of elevator doors. Okay, elevator doors coming together and going up to the 3rd floor. Elevator doors coming together, level 1, 2, going up to the 3rd floor. All right. And we're going to go into more detail next week. I'm sorry I'm over 15 minutes. I was trying really hard just to keep it there. But I warned you, I can talk about this stuff for hours because it is just so amazing to me. So things you might be experiencing really quick: pain with penetration, urge incontinence, stress incontinence, hip pain, back pain, lower abdominal pain. We start all of this with coordination of the pelvic floor. If there's something else I've not mentioned, please leave it down below. Please ask questions. Please let me know if you feel the squeeze and a lift, and stay tuned for next week. All right.